joining us from Kano to share his perspective on the public health emergency response system in Nigeria following the reported death of the 25-year-old Abuja-based singer who we just brought you her story, Ifunanya Wagene. Due to complications from a snake bite is Professor Abdulsalami Nasidi. He's the former Director General of the NCDC, that's Nigerian Communications Disease.
Center for Disease Control.
Yes, Nigerian Center for Disease Control. Thank you very much. We understand that the doctor is not yet on ground to join us, but this story is very heartbreaking. Is he back now? Okay, we do have our guest. Thank you very much. Professor Abdulsalami Nasidi, thank you for joining us from Kano. I wondered if you listened to that report by Hotu Odo captures the story through the eyes of those close to her last moment. But this issue has raised concerns around awareness as well as response. Let me begin by asking you, when a snake bites you, what do you do? And how important is what you do?
Well, good evening, and good evening, Nigerians. It's very unfortunate we have this incident and the waste of very precious life, and we pray may her soul rest in perfect peace. Issue of snake bites should be treated as a medical emergency, irrespective of the type of snake. First and foremost, it's a waste of time to start thinking, which type of snake has bitten somebody. So there are two things that do happen when people find out that they have been bitten by a snake. In several cases, people don't even know that it is a snake that has bitten them, because the bite is usually like a prick of a needle, and until the envenoming starts spreading before you know that it is not a simple pricking from a needle or a stick. So it's a bite. So in the cases that somebody does not see the snake that has bitten him or her, they don't panic. But if, like in the case of Ify, when she woke up and realized that she had the pain at the site of bite and saw the snake, it will immediately send a state of panicking into her mind, and she will be doing things that she's not supposed to do, that will facilitate the quick circulation of the venom into the system. The snakes, they have these venoms not just for fighting or defense. That is their means of feeding. When we want to eat food, we get our food, we cook it, we process the food and eat. They swallow their own food raw, and it is the venom that they inject most of the time into their prey that inactivates the prey and also help them to digest that food that they have eaten. So venom for them is very important, and for us is real serious medical emergency. So if somebody is bitten by a snake and he's aware that a snake has bitten him, the more he moves, the more the venom circulates in the body. And that's why one of the first things to do is to immobilize the site this snake has bitten a person, and then minimize movement, and if possible, if you can get people to help to carry you or her to a medical establishment. Often than not, we quickly rush, we panic, we tie the extremities where the snake has bitten, thinking that that will limit the circulation of the antivenom. In some of the snakes, like the carpet viper, the more you tie, the worse it is for the person that is bitten, because the poison will still circulate, and then if it passes the area into full blood circulation, it can cause more severe envenoming with all the consequences. So the first thing to do is minimize panicking and start thinking of how to reach a medical establishment for treatment.
I mean, thank you so much for that. And there's so much talk about the need to have anti-venom snake, medication at home, what are the things that you should have? In a place like Abuja, for example, I mean, in my estate where I live, you have hills here and there are always, stories of snakes, and snake infestation. What do you need to do at that level to, treat snake infestation in Abuja? And, of course, the hospitals, the emergency response system. How do we ramp it up? Because based on this story, there seems to be a not too satisfactory response from the hospitals. How do we ramp up emergency response in our hospitals, both in private and public hospitals?
Well, snakes are usually ambush predators. They like to hide, they sneak, and so they like bushy areas. So if you are living in any environment and you allow bush to grow in and around your house, you definitely have the snakes coming in and out of your abode. And this is because this is where their own food is grown. The rodents, the lizards, and the cockroaches and others that they feed on are usually around those bushes. So if you don't want snake to enter your house, you definitely have to take care of your environment, clear the distance of the bushes and so on and so forth. Then, it is also important to know that in the area, especially where we are living in the savannah and, Guinea savannah area, you have hills, you have grasses, you have this. What is so crucial is health education, health communication, to let people know that, yes, we could be living with these snakes in our environment or even in our houses, as we have seen in the case of Ify, right in her bedroom. So we need to let people living in these environments to know what to do if they have an encounter with a snake. And unfortunately, this is minimal. If he hadn't got the communication gadgets she had, let's say this happened in the village or in the areas where the poor are living, and it is the poor that are more important victims, like snake bites, affects more farmers, herders, and even school children going to school, especially early in the morning when they are all coming out. So what we need to do is to enhance, health education, training people on what to do and what to stock, just in case, you have any encounter with a snake. So on issue of either leaving the anti-snake venom in your house, it's not something that we should even discuss. But most important, every community that is living in high incident areas like we are, should know that there should be a site, an address that will be stocking anti-venom, either a clinic or a primary healthcare center or hospital, where we create treatment centers. So when it occurs, we rush the person bitten into those places. Antivenoms are not easily administered by anybody. Even if you have it, you take it to the hospital, there has to be people who are trained to know how to handle it. Because if you handle it wrongly, it can give anaphylaxis, and people could even die not from the venom of the snake, but on a reaction to the anti-snake venom. And this will bring me maybe to talk about the type of antivenoms and what is really happening now in our country and West Africa.
Okay, Prof, that's very important because I wanted to ask you, in addition to what you've just highlighted, at your time in the CDC, is Nigeria adequately prepared to administer emergencies like the antivenom, envenomation, you call it in medicine, plus the point you've highlighted? Do we even have enough hands? Do we know? Do we have enough people who understand how to administer this?
Yeah.
In fact, I would say we should congratulate ourselves for being in the forefront of, doing this and preparing our nation for this emergency. Right from the time of Professor Olukoya Ransom Kuti, there was an initiative to develop our own antivenom against our venomous snakes, and he put us together, with experts from UK, and we picked our snakes from Kaltungo, and they collaborated with Oxford University, Liverpool School of Tropical Medicine and Hygiene, London University, Ahmadu Bello University, and Lagos University, and we developed a most specific, highly effective antivenom, which we have been using against the 3 most important public health snakes in Nigeria, which are the carpet viper, and then the puff adder, and then the black-necked spitting cobra. So these antivenoms are, available, and we have been proven worldwide to be one of the most effective antivenoms ever developed. And it's very important, to say that we are the first nation in the third world to establish specific treatment centers. We had about 8 treatment centers in all the zones of the country, and we managed to reduce fatality, that is death from the snake bites, in and around these treatment centers from about 20–40% to less than 1%. So it's a great achievement. Nigeria is prepared, and we have this antivenom. But unfortunately, the issue is that as we even speak now, we have some of the antivenoms available in the country. Aside by some of these effective antivenoms I've mentioned, but side by side with them are also so many circulating, fake antivenoms that don't work. And even if they take the patient, protect the patient. As we can see from this case, we already have a very good example of the fact that the hospital insisted they gave the antivenom, and yet the patient did not respond, and we lost the patient.
Oh my.
So now we have the Equitab, the antivenom we developed, in partnership with our British counterparts. It's called the Equitab. And we have the one that is against the most dangerous snake, which is the carpet viper, and this is the snake seen mostly in the northern savannah. And then also we have the polyvalent one, which is against the cobra, black neck spitting cobra, which is more frequent in the south, and also the puff adder, which is everywhere in the country. So with this, there is no reason to say that we cannot have, effective antivenom to treat any victim. So nobody should actually die from snake bite again in Nigeria. But unfortunately, there is no enough, to circulate. Yeah. So we have deficit. We have serious deficit of this antivenom in the country.
Right.
And we already have
so much,
collaborated
Prof.
with a factory in yes,
Prof.
In Wales, that we have produced and imported some.
Thank you very much, Professor Abdulsalami Nasidi, there, former DG, Nigeria Center for Disease Control. Thank you very much for your contribution. I wonder what is scarier. Is it the snake bite or the fact that there could be fake, anti-venom in circulation? Thank you very much for joining us.